guys. Noon, day, amazing. Um, yeah, welcome aboard. End of the month. July is almost finished. So we begin on to August. One more day of July, then we start August 3rd. So this morning we did. Sorry guys, I'm cutting off. I don't know what to do. We had one router here, so hopefully it doesn't continue. At best, using my headphones. So Wi-Fi is full speed. Continues. So I doing better, Dr. Singh? Can you hear me now? I don't know. You said use my settings. Settings I would use. My speakers here, video, exactly what I do. So continues. Test. 1, 2, 1, 2. Yeah, I'm checking my audio settings. I don't know what else I can do. Or automatic adjust microphone specific inputs. I can do. Could be combination of laptop, but it's used. So it continues. So I will double check that, guys. Thank you for letting me know. I hope it doesn't continue because I need you guys to hear me, right? So let me try this. Maybe it's aggravating. Could this be better? Hopefully, maybe yes, maybe no. Let me know. Hopefully it doesn't, because shouldn't be going in and out. Let's see, background secondaries. Got my background noise, auto, high, medium, low. Again, let me know. Hopefully it works. Not, I'll look into it after the session, and see what else I can do to improve. At the same time, just give me thumbs up, thumbs down, cut me off if you can't hear me. Do my very best to continue. Okay, guys, and again, if you can't hear me, that's the problem, right? So gotta fix it, and so we have no issues moving forward. So today we're doing male repro, and with male repro we have multiple areas to basically get points. How are you all feeling with this topic, repro? Challenging, I think. We need to know a lot because it's obviously male and female, right? So that being said, disconnected. Yeah, so what do you mean, Dr. Cooper? Talk about the actual topic. Oh, knowledge, yeah. I mean, it's tough, right? So overall, we can't spend time learning everything. You could if you want. Ideally, depending on your time frame, if you had 4 or 5 months study and you review everything. So what I would say is if you have Amboss, you could go into Amboss and break everything down, male versus female. Typically, like I mentioned to you, cancers is something that you can use to get points. Pharmacology is pretty big, and doing it this way allows you to really conquer most of the material, right? Hormones are important. Definitely have different conditions that they will push you to the next level. Ideally, when it comes to male versus female repro, done first part of the month, we do female, the next part we do male, whether you're doing breast diseases, cervical cancers, uterine cancers, that's pretty big. You have to be able to differentiate, right? Benign versus malignant, age, different conditions that are predominantly found in different areas, non-invasive versus invasive, right? This is what you have to do, guys. I hope you understand this is why I do what I do every day. Thank you for being on board together, because I'm telling you, People who try to study and review everything, you could. You'll just find yourself 6 months in, a year in, and still be where you were because you have to keep reviewing what you read 6 months ago. It's a vicious cycle. So, today's repro. Did mention it before, and Tuesdays are repros. So I want you to jump on, and I'm going to do some cases together with you guys. Today we're doing male, so I've chosen a couple of testicular tumors, other things with prostate, epididymitis, orchitis, urethritis, BPH, hormonal questions, reproductive hormones, because I need to know what you know, and you should see what you know as well. If it's challenging, either A, you work on it, or you hope you don't get it on the exam day. Fortunately, you have to get the points where you can, right? So this is why I am showing you what I can possibly show you in a short time frame to knock out the questions and move on. So I want you guys to raise your hand. Sing jumps on usually. I'd love to have you guys to participate. Everyone, if you can. You guys have to work together to jump on board to do questions. Dr. Singh, let's go. You say even the group doctors. Dr. Singh's like, I will do questions. How are you, doctor? How's everything?
Good. Excuse me. Sorry.
Yeah, I don't know. I'll check. Not my pleasure. It's okay. I'll check the Zoom. I don't know why. I mean, I know I travel with this Wi-Fi. It's annoying and aggravating, whether it's microphones or the actual. Do a hard reset and check it out. How are you doing with your studying?
It's going well. I'm just trying to do more specific questions and like kind of expose myself, like you were saying earlier about like NBME questions. So I'm trying to do that and like trying to keep up like the same pattern so I don't lose it.
Yeah, I mean, that's all you can do. I students one-on-one for step one, and they had similar issues as far as they keep forgetting things. So I said, well, all you got to do is your day needs to be broken down to 3 sections. Review in the morning, spend the day focused training, the rest of the day mixed block of questions. As you move on, eventually the focus turns into mixed. Then you start doing 2 blocks, 3 blocks, 4 blocks, so to see if your focus and concentration is there, to then pass the test. That's the basic routine structure for step one pass. You jump a couple of steps. The problem is your knowledge isn't strong. You start mixing questions up. You start forgetting biochem, micro, and immuno. Then you're back to square. So this is where we have to keep pushing, right? So doing well. We wrote today. I have my first data open again. Let's knock out a couple of questions like last time with Dr. Patel. Let's read the scenario, see what we got. Let's attack, let's hit. You guys are here for a reason. So let's work together on this workshop, right? Let's attack.
Okay.
Let's do it.
All right. Physical examination shows a firm, non-tender nodule on the right testes that does not transluminate. His serum alpha fetoprotein, the ALP, and beta HCG concentrations are all within normal limits. This patient's testicular tumor is most likely which of the following type? Okay, from what I remember, if it's all normal, it's usually a teratoma.
So you remember a few things, right? So we have many conditions. We have obviously tumors, either germ cell or non-germ cell, right? So you realize that there's only a few non-germ cell tumors. We have septoli, and then we have testicular lymphoma. You can see these, they don't really have any markers. See markers here. These guys have markers, seminoma, renal carcinoma, teratoma, so on. They have something. Seminomas have increased placental alkaline phosphatase. Carcinomas, they have increased beta HCG. You can see they all have some, okay? Teratoma, remember what we know about this? Mature teratomas, maybe malignant, and adult males. Kids and females, you guys are good. Only in males is malignant. So very good. Now, do you remember, do you usually memorize this kind of charts? What do you usually do?
I try to because that's like the easiest way. I would just like write them down on a cheat sheet just to make sure I don't forget them,
Right?
and then like repeat them so that way it sticks.
Whatever works for you, right? Whatever
Mhm.
works for you. So clearly you said, well, they're all normal. So it has to be teratoma. Right? Awesome. 32% got it right. Okay. So 32% got it right. Pure teratomas do not cause elevation of symptoms. So this is what you need to remember. This is how you get points in repro. This is real. Repro is on exam. What degree? I can't tell you, but honestly, they ask you questions and answer. It's markers, okay? So knowing that teratomas have no elevation of tumors, so all three are normal. Okay, cool. What are these guys again?
So the Sertoli and the testicular lymphoma, those are the non-germ cell ones.
Tertulli is non-germ cell. Testicular tumor is non-germ cell. And what else is non-germ cell?
The Leydig.
So out of all the other ones, these three are non-germ cell tumors. So I mean, look at it a couple of times. Know how to differentiate. And look at this: 27% went to this one, 13 went to this one, and 20 to this one. So more than half literally went to the wrong side. I mean, the non-germ cells we know have two. So these would be out, and yolk sac we know is usually kids, right? Yolk sac
Uh-huh.
and then cementless, bilateral, usually are associated with increase of protein. It's coming tested what? What puberty? Know that we've seen that, right? So study, see, go back and look at your ages. Say, okay, we have different types: germ cell, non-germ cell. We need to be able to differentiate the different types. If you can't, you're just going to walk in. Oh, this is how you pass the test. If you get questions like this, great. What do you think about this?
Sorry, you cut off. What did you say?
I said, what do you think? What do you think about this? Do you agree with the approach? Do you think it comes to these kind of systems and organ systems that people might have issues with?
Yeah, I think like sectioning it out helps quite a bit, and then being able to like at least focus on the markers that are present so you
Yeah.
don't forget them, and then you don't have to worry about remembering the extra stuff.
Okay, that's what you guys have to do. So if you want to pass the test in less than 60 days and you have a decent foundation, this is what you need to do to get the points to pass, right? Or else the longer you take, the longer it's gonna take time to remember things. You have to retain everything as you move forward, right?
Mm-hmm.
Let's try this one.
Okay. Laboratory studies show increased serum concentrations of BHCG, beta HCG, and ALP, and serum AFP concentration is within reference range. The right radical inguinal orchiectomy is performed. A photo micrograph of a section of the removed testicle is shown. Which of the following is most likely diagnosis? Okay, so right from there, we can at least get rid of like the non-cell germinoma, non-germ cell. Um, so testicular is out.
Okay.
And then the embryonal sarcoma, I think. No,
The
is that
non-germ
this?
cell, there are
No.
three. There's Leydig, there's Sertoli.
Sertoli and testicular lymphoma. Okay, never mind. That one's
It's
in
okay.
then.
But we're practicing. So we have to practice. So we have here, see, we have SLP, PLS, or
Mhm.
Leydig, Sertoli, primarily. So there's only one non-germ cell. Okay,
Yeah.
so we take out what we know that's not possible.
So
But
teratoma would be out as well because that would be all normal.
you're the teratoma queen. Like, I know about teratoma. You ask me teratoma, I can tell you it's not
Get
teratoma.
rid of it. Yeah.
Now, next.
Okay, since